Okay, we have in our audience today Janice Carlos and Carla Turner. And the references that I use to cite from is the Maternal Newborn Nursing and the Contemporary Medical Surgical Volumes 1 and 2. Most women are excited at the thought of being pregnant. However, many do not consider that sometimes something can go wrong during a pregnancy. One of these things being preeclampsia. For a diagnosis of preeclampsia, there must be hypertension and proteinuria. Hypertension is a term used to describe high blood pressure. Blood pressure is the measurement of force against the walls of the arteries as the heart pumps blood. Blood pressure readings are measured in millimeters of mercury and given as two numbers. The top number of the blood pressure is the systolic pressure and the bottom number is the diastolic pressure. Prehypertension is when the systolic number is between 120 and 139 millimeters of mercury and the diastolic number is between 80 and 89 millimeters of mercury. For hypertension, the systolic must be greater than 140 and the diastolic greater than 90. The next part required for this diagnosis is proteinuria. Proteinuria is the presence of protein in the urine. The presence of protein in the urine is abnormal. There are two mechanisms that normally prevent protein from passing into the urine. One being the glomeruli. It provides a barrier that keeps most of the larger portion of protein plasma inside the blood vessels. This aids in decreased protein in the urine. However, sometimes small proteins are able to pass through this barrier. When this occurs, they usually reabsorb in the tubulus. Proteinuria is defined as a protein-creatinine ratio greater than 45 when tested with a dipstick test. Pregnant women should be aware of the signs and symptoms of preeclampsia. Any indication of hypertension or proteinuria should be reported to their physicians immediately. Do I have any questions from my audience?
We'd like to know if there are any treatments for preeclampsia.
The only treatment for preeclampsia is delivery of the baby.
Okay, and is there anything during pregnancy that you can look for to prevent a diagnosis of it?
Right now you can't prevent a diagnosis of preeclampsia because they do not have a cause for preeclampsia, so therefore there are no preventative measures that you can take to prevent a diagnosis of preeclampsia.